Thank you very much. Moving on, it is my honor to invite Shri Avinash Joshi Sir, IAS, Principal Secretary, Health and Family Welfare, Government of Assam, to deliver the welcome address.
Very good morning to all of you and welcome to this inaugural function. Honourable Chief Minister of Assam, Dr. Himanta Sharma, who has been a force behind all the transformative changes which we have taken in last few years in the healthcare sector in Assam. And he has ensured that all the sectors, primary, secondary and tertiary, are looked after well by the government of Assam. Welcome, sir, to this meeting. Honourable Health Minister, Shri Khesab Mahanta, sir, who has been guiding us throughout all the phase of all the projects being implemented in Assam and all the initiatives being undertaken. I welcome him also in this meeting. I welcome Shri Shrikant Nadumani, Chairman 10BedICU. Welcome, sir. I welcome Mr. Vinod Khosla and Shri Nandan Nilekani, who will be joining us through video conference. I welcome all the donor agencies representative, including representatives from Karuna Trust, from Guwahati Refinery, HDFC CSR team. I welcome Shri Tuliram Rangong, Chief Executive Member of Karimganj Autonomous Council. I welcome all my colleagues from Health and Family Welfare Department, from Medical Education and Research Department, distinguished guests, ladies, gentlemen, and dear friends. Today indeed is a red letter day for critical care for the people of Assam. Initiative launched today will change the landscape of critical care and advanced care in the district hospital and medical college. Today is again important because a lot of initiatives which we are going to inaugurate today are in the PPP mode. So that shows that Assam has come to a stage where we can positively involve the private sector also in the healthcare initiatives. I will just talk very briefly about 10BedICU project. In this, we have created 365 ICU beds across 23 hospitals. The 23 hospitals will work as a spoke, and that will be guided by 3 medical colleges which will work as a hub. Tele-ICU will be there, deployment of Care Health platform. Care is a very advanced platform which provides solutions to in the health sector. And in this project, basically, good part is that there is a training component, there is a capacity building component, and there is a lot of emphasis on the compliance of ICU protocols and standards. The state-of-art medical equipments are provided, and a focused communitization strategy for strengthening Rogi Kalyan Samiti to improve governance, equitable access, and ensure sustainability of the project. I am happy to inform, sir, that under this project, already 2,700 patients admitted and being treated. The good part of the project is 3-year annual maintenance contract is integral part of this project, so that for first 3 years, we will have seamless functioning of this project. Robust technology platform and live dashboard for day-to-day monitoring, live monitoring, is the key part of this project. Other 5 projects which we are going to inaugurate today includes multidisciplinary research unit at GMCH, molecular oncology lab at State Cancer Care Institute, National Emergency Life Support Skill Center at GMCH, 32 slide CT scan machine at GMCH, and medical asset management system for medical colleges. Dr. Siddharth, my colleague, will be talking on this at the later stage, so I will not take much of time on this. Once again, I welcome all of you in today's program, and I am confident that this tech-driven initiatives will go a long way in providing critical health care to the needy patients of Assam. Thank you so much and welcome once again.
Thank you, sir, for your informative and pleasing words. Now we have a small project audio-visual that would throw light on the details and magnificence of these schemes. I request our technical team to kindly play the audio-visual.
Assam is emerging as a leader in change and development. When the pandemic caught us all off guard, Assam stood up and showed how preparedness and proactive leadership could turn a tragedy into an opportunity.
We responded to the situation in a very coordinated manner because the whole team was in one place. The current CM was the health minister at that point of time, Dr. Himanta Biswa.
লগত থকা মানুহখিনি আমি ইতিমধ্যে কোৱাৰেণ্টাইন বা আইসোলেশন কৰি ৰাখিছো গতিকে আমি বহুত বেছি পেনিক হোৱাৰ প্ৰয়োজন নাই
We had a review system every night at the highest level of the health minister.
The 10BedICU project, conceived by Mr. Shri Nandan, the founding CTO of Aadhaar, was a response to the COVID-19 pandemic to improve the critical care infrastructure and prepare us against subsequent pandemic outbursts. From disaster relief, the project has now evolved into a system-strengthening project with 5 intervention pillars and is being implemented across 9 states. In Assam, the Department of Health and Family Welfare entered into an MOU with the E-Government's Foundation and Karuna Trust to implement the project across Assam in convergence with the Assam Critical Care Infrastructure Project. First pillar is to provide a set of world-class equipment and help set up an ICU ward in every district hospital to create and provide ICU infrastructure to critical patients closer to their home.
The peripheral districts like Kachar, Karimganj, Hailakandi, then Haflong, all the patients used to come to us.
আমাৰ মৰিগাঁৱত যেহেতু আইচিউৰ সুবিধাটো নাছিলে আজিলৈকে গতিকে তেওঁলোকক আমি বা ৰোগীৰ কৰ্তৃপক্ষও তেওঁলোকে বিচাৰে যে তেওঁলোকক হায়াৰ চেণ্টাৰলৈ ৰেফাৰ দিয়া
Second pillar, tele-ICU hub and spoke. To address the shortage of specialists, Assam has set up 3 tele-ICU hubs connecting all the ICU wards at district hospitals to centralized hubs at Guwahati Medical College, Silchar Medical College and Dibrugarh Medical College. Specialists at these medical colleges attend to patients in remote ICU wards.
We have the largest ICUs. We have 660 ICU beds. In fact, it's one of the largest ICUs in the entire country. And we have huge number of intensivists, huge number of anesthetists, the medical specialists taking care of these patients.
I come to know that it's a big hurdle for them to come to GMCH. And I can see that in many instances, those things could have been handled there only.
Those cardiac cases, cerebrovascular accident cases, other metabolic and encephalopathy cases, or even some respiratory failure. With the establishment of this ICU and tele-ICU, now those patients we are treating in Karimganj.
Third pillar, training and capacity building.
It is a very good work which has been done. And building on that work, I believe a lot of work in fact needs to be done on the nursing care part, training, capacity building and even the educational part of the nursing. Because nursing care is ultimately which defines how a hospital is being run. So we are looking at improving the nursing care in a big way. Any technology may not be able to substitute for the human care. So improvement of capacities of the humans that are manning that technology is something which is very, very important.
Training and capacity building of our doctors and nurses is a core component of the project. We provide training on equipment and technology. Also certification courses on critical care in collaboration with medical colleges and universities.
Fourth pillar, Care Technology Platform. CARE is 10BedICU's technology platform that helps deliver critical care, especially in under-resourced environments. It consists of an EMR or electronic medical record so that all the medical details of a patient are stored digitally, be it consultations, lab test or imaging. It provides advanced modules such as tele-ICU, pandemic management, AI specialist and analytics dashboards. Fifth pillar, communitization for sustainability.
How do you ensure the poorest have access to the facility, and how do we ensure that the quality of the ICU ward is maintained and upgraded with time? For this, we will closely build the Rogi Kalyan Samitis in the hospitals.
HDFC Bank is proud to support 7 government hospitals located in remote corners of Assam.
The 10BedICU project can be a great example of the multiplier effect of public-private partnerships. We all actually worked as one team with the superordinate goal of benefiting the people of our state.
I must congratulate Assam government and e-government foundation for providing this facility of 365 ICU beds across 23 hospitals in the state. And I hope that this will pave the path for critical care in the state of Assam.
Thank you so much. It helped us to gain an insight to this huge project. The 10-bed ICU is a system strengthening project to improve the critical care service delivery at secondary hospitals through the use of technology. To enlighten us more on this project, I would like to invite Mr. Shri Nandan sir, founder CTO, Aadhaar, chairman of 10-bed ICU project, to the podium.
The Honourable Chief Minister, Shri Himanta Biswa Sarma, the Honourable Health Minister, Shri Khesab Mahanta. It's indeed an honour and a privilege to be here in Assam. Today is a very special day for us at the E-Government Foundation and the 10-bed ICU project that you're here with us to launch this. And welcome to all the dignitaries on the stage, as well as many of you out here in the audience, as well as people out there on Zoom calls and YouTube broadcasts that's out there. You know, the question I keep getting asked since I was the CTO of the Aadhaar project during its founding is India's digital public infrastructure, which is the talk of the world today. And as the president of G20, India is talking about how to improve digital public infrastructure around the world. Often people ask me, how was Aadhaar designed for 1.3 billion people? How does UPI do 9 billion transactions a month? These are good questions, and India has actually figured out how to do this. And I'll share with you a little bit of this, because if we can bring that kind of scale to healthcare, especially in Assam, then we can transform the state from a healthcare perspective. Aadhaar itself not only enrolled 1.33 billion people, it has done 74 billion Aadhaar authentications to date. It has done 12 billion KYCs that helped people get bank accounts, get SIM cards, and so on. And we also linked it with bank accounts so that direct benefit transfers, $300 billion worth of direct benefit transfers went through. Which brings me to the next point on payments. UPI, Universal Payment Interface, did actually last month, it clocked a record 9.5 billion transactions in 1 month. We did $1 trillion of value moving through our payment systems, more than the United States, Europe, and China put together, right? This is the impact of what these standard systems have done. So what is the magic that allows these to scale, and can we bring this to healthcare? There are 2 aspects, technology and standards. That's what drives large-scale projects with high-quality outcomes. So in this particular project, the 10-bed ICU project for critical care, we have looked at digital technology for medical devices. We have some of the state-of-the-art medical devices we'll talk about. The use of networks to connect hospitals, to connect doctors and nurses to patients in far-off remote areas. The use of data analytics and dashboards in order to make better decisions to improve outcomes. And of course, use of AI. We have a very interesting project I'll talk about in a minute about the use of GPT kind of generative technologies to improve healthcare. Coming to standards, standard implementation process across the state of Assam. As you would have seen, we have gone through a lockstep, one step at a time throughout the state on all the 23 districts. ICU equipment standards to ensure that whatever is launched in one hospital is exactly the same being launched everywhere, so that the training modules, the upkeep, the AMC, all of that is standardized, and we can keep a high level of standard delivery there. Standard ICU protocols on the clinical side. I see a lot of you in white coats, doctors and nurses, standardizing ICU protocols. Famous book by Atul Gawande that talked about the checklist manifesto, the same approach here. Can we come up with protocols for standard diseases and types so that it helps us improve the quality of care, and so on. Data interoperability standards of HL7 and ICD codes and so on. So this is what we've done. So when you look at equipment, in fact, we imported equipment from Switzerland, Hamilton Medical, AI ventilators for adults, pediatric as well as neonatal, but more importantly because it has an auto-weaning AI facility. Even without a specialist, it can auto-wean the patient. Or the blood analysis equipment coming from Siemens, and so on. These are top quality equipment. This is not, the L1 equipment that we're talking about. And this is the standard that we offer in every hospital. Number two, the care technology platform. This is sort of the way we built Aadhaar, layered and modular, but more importantly, integrating with Ayushman Bharat digital mission. The health ID claims, in fact, we were talking about it. You have over 1.5 crores health IDs, ABA numbers. And today, can we integrate that? Those that have been created, the new ones that have to be created so that people get access easily. That's part of the project. HCX claim processing, whether it's the Ayushman Bharat insurance or your own CM's insurance cover, which I heard is pretty good. Can that be integrated into the systems? That work is currently proceeding. The registries, ABDM registries of hospitals and nursing, all of that is part of this care technology. Today, care has been recognized by the United Nations as the 50th digital public good in the world, because it's not only being used in 9 states in India, but also many other countries. Next is data-based decision making. The Assam state dashboard we have built for this 10-bed-ICU project basically allows data to come in from all the hospitals in a standard way in order to ensure that you can see in one place the number of admissions, whether it is by gender, by the age, by the different types of categories and so on, as well as you're seeing the active patient rate increase on the bottom, which is basically signifying that a large number of people are starting to use it, even though it has actually been launched only in about, being used in about 5 hospitals right now. After today's launch, it's going to open up to about 23 odd hospitals. But this is again based on standards and technology. This is dynamic data. Nobody is entering this. It is coming through our care electronic medical record package automatically from all across the state. And sir, I can tell you that this dashboard can be offered in your office so that you can also track the number of consultations, the number of patients, the lives saved in real time. Coming to clinical, we are standardizing ICU protocols so that the outcomes are improved for patients. Here is an example of septic shock protocol, which has been, we have today about 200 hospitals, a lot of doctors who are working with us from government, from private sector and so on. These standards help nurses and other doctors to look at it as a flow chart and actually administer care. If there is no specialist in the middle of the night and a nurse is seeing something really scary happening in front of her with a patient on, let's say, septic shock, she's able to look at this poster and try to figure out what to do next. So we are standardizing those ICU protocols across respiratory, liver, cardiac, renal, and other systemic functions, as you can see. This is just one example that I showed you. Training programs are super important. The Principal Secretary talked about it. not just medical equipment training, basic critical care training, the BLS training, advanced life support, ACLS, as well as our software training is all part of the package. Again, standards that we follow. Here are some pictures from the training programs that we hold. Last but not least, so this is the most exciting development in the last few months. The Ayushma AI specialist is something that we have worked with Bombay IIT, with the Rizwan Quetta Center of Digital Health. And we are able to use GPT technology in order to answer questions by nurses. In case they don't have a specialist, they should be able to pick up their phone, go to our app, and ask a very specific question. In this case, and in our own language. It could be Hindi, it could be Assamese, it could be Bengali, whatever, and it should respond in that language accurately, without hallucination. That is what we set out to do, and it is happening. This is working. So for instance, in the case here, we are showing the nurse is saying, I've tried albumin, administers crystalloids, 3 liters, the BP still keeps going down, this person is suffering from septic shock, I think he's going to die, what should I do? I don't have a doctor here. And it is clearly saying you have to go to vasopressin, at this mg, it's giving drug dosing information accurately, okay? So we are still under test, it is not yet live. Obviously, we have to test it thoroughly, but there is a lot of hope that this could help Assam if we can implement it. And we are trying to get Assamese support as well from a language perspective. So, sir, today we have 3 clusters, as the Principal Secretary mentioned, and all these different hospitals, 23 districts that are covered here. So we are incredibly delighted that you're able to join and launch this program for us. And I'd like to take a minute on the donors. Mr. Vinod Khosla, who has probably joined us from California already on the Zoom link, he has funded this project. 80% of this project has been funded by him with respect to the hospitals and the tele-ICU hubs. And Vinod has been a huge pillar of support, not just from a funding perspective, but also from a technology connects and many other things that he's brought to us from the Silicon Valley. HDFC Bank, oh yeah, there we see it. So Vinod is right there on Zoom. It's quite late for him, probably in California, probably about 11 p.m. HDFC Bank Parivartan, the CSR arm of HDFC, they're also here present. They've funded the project for about 6 to 7 hospitals. So we thank them as well for helping us with this project. Google Cloud has been providing us functionality for the cloud functionality, and it has given us 1 free year of access to the Assam government. So we thank Google Cloud for that access. And last but not least, Hamilton, Mr. Schroeder is here from Hamilton in Switzerland, and they have donated 1 ventilator for every 2 that the project buys. So we thank Mr. Schroeder. Bob Hamilton is actually the CEO of Hamilton Medical, and he's also on the Zoom call from Nevada in the United States. So we want to thank all these donors. And we have a wonderful team of people. Biswa Leutenbaum is here somewhere. She's been heading the project, our national program coordinator. And she not only, she started off as a regional coordinator in Northeast, and she's taken over as the national coordinator. We have Chandraban Kakoti, who's here somewhere. He's our state coordinator, and now he's been made the regional coordinator in Northeast. He's orchestrating the program from there. And as you can see, we have a lot of folks here from Northeast that are working very closely with your government. I will not go through this entire list of partners. It is E-Governments Foundation and Karna Trust largely that's doing this program, several donors as you can see, and several partners including the Quetta Center for Digital Health. And so today we are in 209 hospitals in 9 states, and we look forward to your active support to make this successful in Assam. Thank you so much.
Thank you, sir, for enlightening us. It is our immense pleasure to have with us Dr. Siddharth Singh, sir, IAS, Commissioner and Secretary, Medical Education and Research Department, Health and Family Welfare, to introduce us to these schemes. May I request everyone to give sir a huge round of applause.
Tele-ICU hub demo, we forgot. The tele-ICU hub demo has to be done. We forgot about that. I'll just announce. Yeah. sorry, we had a live demo promised to you on the tele-ICU hub, and at the GMCH, they're waiting at the hub to show you a live demo of how they connect with the local hospitals. Go ahead, folks from GMCH.
Yeah, thank you. Good morning. I'm Dr. Priyam Saikia, in charge of the 64-bedded ICU, and now I'm standing at the hub of the 10-bedded tele-ICU project at GMCH. You can see that we are connected to different hospitals from the nook and corner of state of Assam. We are connected to Hailakandi, we are connected to Gwalpara, then we are connected to Haflong, then we are connected to Karimganj. Now, yesterday we, talked about a patient in Mangalore. Now, let's see how that patient is faring today. Now, okay, so this was the patient that we wanted to have a look that day. I can now look at the, the vitals of the patient, right? And then I can have an idea about what are the medications that the patient was getting, whether the patient is getting the medications that were, prescribed. Then ECG was prescribed yesterday. Let's see whether it has been updated or not. Okay, great. Now let us talk to the doctor on duty there. If you can connect to the doctor on duty there. Hello, doctor. How are you?
Good morning, sir. Myself.
Yeah. So, doctor, yesterday we talked about the patient and we, suggested certain modifications. And how is the patient doing now?
Also, the patient was improved since 2 days. Mainly, patient is a case of lower respiratory infection with patient was improved symptomatically.
Okay. When I look at the patient's vital, I can see that she has improved. So, if you have any other queries or if you need any one of our help, please feel free to call us.
Okay, sir.
Okay, thank you so much. Now you can see that we can access the patient's data, whether the patient's vitals or the patient's medication or the patient's investigation, whatever the doctor who is there can access, we can also access from here. We do not need to be physically present there. And even without being physically present, we can access to all of the patient's data. We can communicate live, and then we can come to a conclusion. And it is not necessary that I have to sit even in this hub. If I can access those data even with the app that is available to us. Thank you so much. Okay.
So following on this wonderful presentation, Honorable Chief Minister, Sir, Honorable Minister, Health and Family Welfare, CM KAC, Principal Secretary, Health and Family Welfare, Director Medical Education, MD NHM, Mr. Nadamuni from E-Governance Foundation, Principal GMCH, faculties from Medical College, our friends from media, students. A very good morning to all of you. Gives me immense pleasure to be a part of the launch program of this very innovative program that we have taken up, the government of Assam has taken up with the E-Governance Foundation. This will extend our outreach of ICU beds without any substantial investment in the infrastructure. In the brick and mortar, the government of Assam is providing, but the outreach things and technology is being helped by the E-Governance Foundation. Keeping in line with the Assam government's commitment of providing accessible and affordable healthcare to all, 5 other projects are also being launched today by Honorable Chief Minister, and it's a happy occasion for us. These projects may not be very large projects, but would go a long way in improving the health services in the state. One of them is the National Emergency Life Support Skills Center. It would be a simulation lab where faculties, students, researchers would get an opportunity to have live simulation exercises done, and which would help in honing their skills. Then we are going to have the launch for multidisciplinary research unit, which is sanctioned by the Government of India. Here we have an MOU with Government of India, and we'll be setting up in most of our medical colleges. Research would be promoted, and research projects can be taken up under this endeavor. We would like to thank the Guwahati refinery of the Indian Oil Corporation, which has donated funds to us for procuring a 32 slice CT machine for GMCH, which will go a long way. All of you are aware that we have a long list of patients who need diagnostic services, and it would be a great endeavor for us to get this. Another thing that we have got from Government of India is the Molecular Oncology Lab. Now, Molecular Oncology Lab, this is the first of its kind in the entire Northeast. I think it may even be in the Eastern sector. This is the only such lab in the government sector. We have such labs in private sector where a lot of money is charged for these kind of tests. But here it would be done on a very cost-effective basis. It would help in treatment as well as research activities. And finally, we are going to have the launch of the asset management portal for the medical colleges. The Honourable Chief Minister felt that we have this manual system where equipment, all our assets, we don't have any inventory, or we have manual inventories. And as a result, on any given point of time, we are not aware whether these equipment, assets are working or not. And it takes a lot of time to get them repaired and all. So, Honourable Chief Minister directed us and mooted this idea that we should have a live portal where all these things can be. So today we have developed that portal with the help from NIC, and all the assets of all medical colleges would be listed here. In case there is any issue that the equipment or the asset which is not working, a live request would go to the concerned vendors, and then they will be repairing it. So this is the fifth thing on our anvil. I'll not take any more time. This is a great day for all of us. Thank you so much. And I'll just request, because Mr. Nadamuni, because we'll be connecting to Mr. Vinod Khosla, if you want to just give an introduction about Mr. Vinod Khosla, then we can go.
Yeah, well, can we actually, roll Nandan, because I think he had a conflict. Can we roll Nandan first? Get Nandan on Zoom quickly, and then we'll go to Vinod. I know it's a little late for him in California.
Greetings to the Honourable Chief Minister of Assam, Shri Himanta Biswa Sarma, and all the dignitaries and audiences at Guwahati and on YouTube. I am delighted to be here at the launch of the 10-bed ICU program in Assam, a partnership of the Government of Assam, the E-Government Foundation, and Karuna Trust. First of all, let me congratulate you for launching 23 10-bed ICUs covering every part of Assam and 3 tele-ICU hubs at medical colleges. It is well known that Assam's proactive leadership in COVID wave was handled in a very disciplined and coordinated manner. I believe Assam has several medical colleges and is actively investing in increasing healthcare and also making Assam a desirable destination for medical tourism. Shrikant and I set up the E-Government's Foundation 20 years ago in 2003 to help improve governance across the country. I'm very happy that the 10-bed ICU program of the E-Government Foundation is being rolled out in Assam today. And I think we hope it will bring value to the people and the government of Assam. I wish this excellent initiative all success and look forward to many more innovations being implemented in Assam. Thank you and have a great day.
Thank you, Nandan. I know it's pretty late in California, so I'd like to get Vinod on board. Let me give you a very short introduction to Vinod Khosla. Well, he doesn't really need an introduction. He runs Khosla Ventures. He was the founder partner at Khosla Ventures. Famously, he started the Sun Microsystems in California. He was at Kleiner Perkins for many years before he started his own VC firm. But more importantly, I'm there at the Khosla Ventures CEO Summit every year, and he has this fireside chat with Bill Gates pretty much every year. I was just there last month. It's an incredibly interesting talk about transformational technology, and more importantly, things about climate, things about energy, and so on. So it's always a wonderful delight to have Vinod participating in our functions. So with that, I'll hand it over to Vinod, and then, sir, if you have some questions, we can have that facilitated. Go ahead, Vinod. It's yours.
Well, thank you, and good morning, everybody. I'd like to congratulate the Chief Minister, Shri Himanta Biswa Sarma, and the whole government of Assam for creating these ICU wards in 23 districts, of course, with the help of the 10-bed ICU unit. I'm especially happy to see the launch of the 3 tele-ICU centers at medical colleges. It's a dream I've had of this kind of expertise being piped in remotely, through which specialist doctors can help distant patients. We need to adopt such innovative technology to truly address the problem of healthcare in scale, especially in rural India. India's had a very good digital public infrastructure like Aadhaar and UPI, and we need to take a similar approach when it comes to delivering healthcare to the 1.4 billion Indians. 10-bed ICU is a very good example of how this can be done with the standardized digital infrastructure for critical care. And while the 10-bed ICU focuses on critical care at ICUs, a similar technology-enabled approach for addressing primary care and chronic care using artificial intelligence is possible now, and we'd very much like to partner to make that available to every citizen in Assam. India's vast mobile penetration can definitely help with this basic primary care and AI expertise through mechanisms like WhatsApp. And with today's generative technology, and Shrikant Nadamuni referred to this a little bit, a conversational interface in Indian languages for AI to provide assistance is very much possible today, and probably the way we can replicate primary care expertise and chronic care and specialty expertise. So let me just in conclusion say, I'm really delighted to have funded these 10-bed ICUs in 17 of the 23 districts. It's really rewarding to see the program come together. And I'd love to do even more in partnership to get a broader set of healthcare services available to the people. Thank you very much, and I'm open to any questions you might have about myself or the technology or the effort.
Thank you, Vinodji. This is Himanta Biswa Sarma, Chief Minister of Assam. I'd like to thank you on behalf of people of Assam. You have funded 17 ICU today, and this is a great job. And I'm sure that this engagement will be there, and this engagement will continue. And definitely, I look forward more support from you. As a state of Assam, we are immensely committed to health sector. You will be very happy to know that we are a very small state in compared to many Indian states, but we have started a mission to start one medical college in every district. Today, 25 medical colleges in Assam, either we have completed or in the stages of construction or stages of completion. So that kind of commitment we have on health sector. So I look forward for continuous support from you.
Well, thank you.
So, Mr. Chopra, thank you very much for the engagement that you, Mr. Khosla, sorry, I'm very sorry. So, Mr. Khosla, thank you so much for the engagement that you've had with the government of Assam. So, we are expanding our digital footprint also. In fact, as pointed out earlier, Assam has already created 1.6 Aadhaar IDs, which are the digital IDs for patients. So I think this is one area where we can work together. And as you were saying, generative AI is another thing where we can collaborate, at least in terms of a pilot, and we can have a look at some of the outcomes and then help in precision. We can start with small steps and then take it forward if it works well.
Well, I'd love to see that happen and then spread to all over India. So I would very much like to see that. There's also, as you know, many ASHA workers under the PM's program that would be empowered with much more expertise brought to them through AI. So it would be another very good place to collaborate.
Thank you.
Thank you.
Thank you, CM sir, Siddharth sir, and Shrikant sir for facilitating the interaction with Nandan Nilekani sir and Vinod Khosla sir. Ladies and gentlemen, we now move to the felicitation of our distinguished guests with a small token of gratitude and appreciation. To do the honors, I would like to invite our respected faculty members. To begin with, I would like to do the felicitation of Shrikant Nadamuni sir. Next, we move on to the felicitation of P.K. Basumotari sir, CGM Guwahati Refinery. Thank you. Next, we will do the felicitation of Premjit Kumar sir from HDFC Bank. Next, I would like to call upon Dr. Srinivas Padmashri Ma'am, President of American Association of Physicians of Indian origin, for the felicitation. Next, I would like to request Ms. Biswa Ma'am, National Program Coordinator, E-Government Foundation, to please come on stage for the felicitation. Thank you. I request the representatives of the 5 district hospitals of Karimganj, Mongoldoy, Gwalpara, Hailakandi, and Haflong to come on the stage and kindly receive the Certificate of Excellence for their contribution to critical care delivery. These 5 hospitals have already started admitting patients and have treated around 3,000 patients so far. From Karimganj Civil Hospital, we have with us Dr. Subhrangshu Bhattacharya. And I request CM Sir and Health Minister Sir to kindly do the felicitation. From Haflong Civil Hospital, we have Dr. Ronald Bhattari Sir. From Mongoldoy Civil Hospital, we have Dr. Utpal Barua Sir. From Goalpara Civil Hospital, we have Dr. Uday Shankar Medhi Sir. And from SK Roy Civil Hospital, Hailakandi, we have with us Chandrabahan Kakoti Sir. Kakoti Sir is unable to be present with us. I would also request CM Sir and Health Minister Sir to deliver the Certificate of Excellence to PK Basumotari Sir, CGM Guwahati Refinery. So ladies and gentlemen, now I would like to request Honourable Health Minister Sir, Shri Khesab Mahanta Sir, to enlighten us with a few words.
Honourable Chief Minister of Assam, Dr. Himanta Sarma Dangoria, Honourable CM of Karbi Anglong Autonomous Council, Tuliram Ranghang, Principal Secretary Abhinash Joshi, Commissioner Secretary Siddharth Singh, MD NHM Dr. MS Lakshmipriya, DME Dr. Anup Burman, Principal GMCH Dr. Osud Biswa, ED NHM Dr. Manoj Chaudhary, Director State Cancer Institute Dr. Vibhas Chandra Goswami, Chairman, Founder, CTO, Aadhaar, Chairman Khosla Labs, Co-Founder, E-Government Foundation, Shri Nandan, Dr. Padma Shri, Vice President, American Association of Physicians of Indian Origin, Raj Chakraborty, Commissioner Secretary PWD, Premjit Kaur, Circle Head SDFC, Shri PK Basumotari, CGM Guwahati Refinery, officials from Department of Health and Family Welfare, MER, faculty, staff, students, GMCH, friends from printing and electronic media, ladies and gentlemen. Today, we have gathered here to celebrate few significant milestones in our journey to enhance healthcare delivery in Assam under the leadership of our visionary Chief Minister, Dr. Himanta Sarma. Firstly, the inauguration of the state-of-art
10-bedded ICU wards across 23 districts hospital with 365 beds marks a remarkable achievement for our healthcare system. During COVID-19 pandemic, Government of Assam has taken various steps to strengthening the health infrastructure in the state, including setting up of ICU, medical oxygen generation plan, LMO, etc., under the leadership of our Honourable Chief Minister, Dr. Himanta Sarma, and various projects also taken up under various Government of India initiative like ECRP2 to deal the COVID pandemic. Various private partners, NGOs also supported to implement project under CSR fund of deal with COVID pandemic. The 10-bedded ICU project is a crucial component of the larger Assam Critical Care Infrastructure Project initiative, which aims to improve critical care services in Assam by upgrading the strengthening and healthcare infrastructure in the state with support from eGov Foundation and Corona Trust. We are also inaugurating 3 tele-ICU hubs, one right here at Guwahati Medical College and Hospital, and others at Silchar Medical College and Hospital and Assam Medical College and Hospital in Dibrugarh. All the ICUs shall be spokes connected to a medical college which is designed as its hub's location. The hub location of GMCH is connected Dr. Robiboro Hospital, Baksa, Gawpur SDSCH, Bishwanath Sariali Civil Hospital, and JSB Civil Hospital, Sirang, Mongoldoi Civil Hospital, Gwalpara Civil Hospital, Sonapur District Hospital, Singimari Model Hospital, STSG Civil Hospital, Morigaon, and Nagaon Civil Hospital, SMK Civil Hospital, Nolbari, Konaklata Civil Hospital, Sunitpur, Udalguri Civil Hospital. The hub location of SMCH in connected Haflong Civil Hospital, Eskeroi Civil Hospital, and Karimganj Civil Hospital. The hub location of AMCH connected to Sonari Civil Hospital, Dhemaji Civil Hospital, Naharkotia SDSCH, Golaghat Civil Hospital, Bokakhat Subdivision Hospital, Sibsagar Civil Hospital, and Tinchukia Civil Hospital. Total 23 location, spoke location, and 3 hub location with connected. I congratulate the entire team of 10-bed ICU project, Department of Health, NHM, GMCH, AMCH, SMCH, and the district hospitals. I look forward to similar initiative in healthcare sector in near future. Besides the 10-bed ICU project, we are inaugurating the state-of-art infrastructure. National Emergency Life Support Skill Center was set up at Guwahati Medical Colleges and Hospital with financial support from the Ministry of Health and Family Welfare under District Disaster Management Cell for advanced training and the students, staff, and faculties. It is 5 modern simulated skill lab for advanced emergency life support skill training. A multidisciplinary research unit of Department of Health Research, Ministry of
Health and Family Welfare Government of India was set up strengthening the research activities of faculty and students of Guwahati Medical College and Hospital during the year 2021-22. It has all the modern equipments for advanced diagnosis and research. Currently, 5 research projects are in progress. 32-slice CT scan machine set up at Guwahati Medical College, funded under corporate Environmental Responsibility Scheme of Guwahati Refinery and Indian Oil Corporation Limited for the benefit of the people of Assam. I thank Guwahati Refinery and IOCL for their kind initiative. The Diagnostic Molecular Oncology Laboratory, State Cancer Institute, Guwahati Medical College and Hospital is the first of its kind in Assam and Northeast, with the state-of-art equipments, advanced technologies for analyzing the genetic markers and conducting screening. It is a project under National Program for Prevention and Control of Cancer, Diabetics, Cardiovascular Diseases, and Stroke scheme of the Ministry of Health and Family Welfare, Government of India. A portal designed by NIC, Assam under the supervision of DME, Assam for asset management for medical colleges will also be inaugurated today. It is a comprehensive solution designed to streamline and asset management process for the medical colleges of Assam. Our Honourable Chief Minister, Dr. Himanta Biswa is kind enough to encourage the health department in all its ventures. He has been constantly guiding us for which department is able to reach where it is now. And I am hopeful that the department will be able to achieve many more milestones in the years to come. Thank you all.
Thank you so much, sir. Now we have arrived at the most awaited moment, that is the inauguration and unveiling of the schemes. To do the honors, I request our respected CM sir to unveil the projects. Now, sir will unveil the plaque. And there will be the unveiling of asset management portal through pressing of the remote. Thank you, sir. Ladies and gentlemen, it is my utmost honor and privilege to request our respected and beloved CM, sir, to enrich us with a few words. Please give sir a huge round of applause.
অসম চৰকাৰৰ স্বাস্থ্য মন্ত্ৰী শ্ৰী কেশৱ মহন্ত ডাঙৰীয়া, শ্ৰী শ্ৰীকান্ত নাদুমুনি, founder chief technology officer Aadhaar and co-founder of eGov, Shri Vinod Khosla, who is connecting with us from United States of America, Shri Nandan Nilekani. আজিৰ সভাত উপস্থিত অসম চৰকাৰৰ স্বাস্থ্য বিভাগৰ প্ৰধান সচিব অবিনাশ যোশী ডাঙৰীয়া, আয়ুক্ত সচিব সিদ্ধাৰ্থ সিং ডাঙৰীয়া, NHMৰ মিছন ডাইৰেক্টৰ ডক্টৰ MS লক্ষ্মীপ্ৰিয়া ডাঙৰীয়ানী, ডাইৰেক্টৰ মেডিকেল এডুকেশ্যন ডক্টৰ অনুপ বৰ্মন, গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ অধ্যক্ষ ডক্টৰ অচ্যুত বৈশ্য ডাঙৰীয়া, Director State Cancer Institute Dr. Bivas Goswami Dangoria, Indian Oil Corporation or CGM Shri PK Bosumotari Dangoria, HDFC Banker Circle Head Premjit Kaur Dangoria, অসমৰ বিভিন্ন ঠাইৰ পৰা ভাৰ্চুৱেলি সংলগ্ন হৈ থকা আমাৰ চিকিৎসকসকল আৰু আজিৰ সভাত উপস্থিত সুধীবৃন্দ, ৰাজ্যৰ স্বাস্থ্য সেৱাৰ আধুনিকৰণ আৰু সবলীকৰণৰ দিশত আজিৰ দিনটো এক বিশেষ দিন। আজি আমাৰ সন্মুখত আমি এনে এটা সুন্দৰ প্ৰকল্প উদ্বোধন কৰাৰ সাক্ষী হ'ব পাৰিছোঁ, যিটো প্ৰকল্পৰ জৰিয়তে অসমৰ ICU কেয়াৰৰ যিটো পৰিৱেশ তাক এটা সম্পূৰ্ণ পৰিৱৰ্তন কৰিব পাৰে। কোভিডৰ পৰিৱেশৰ সময়ত আমি সকলোৱে ICUৰ প্ৰয়োজনীয়তা আৰু ICU মেনেজমেণ্টৰ ওপৰত আমি আলোচনা কৰিছিলোঁ আৰু ৰাজ্য চৰকাৰ আৰু কেন্দ্ৰীয় চৰকাৰৰ সহযোগত আমি সমগ্ৰ ৰাজ্যতে ICUৰ সংখ্যা যথেষ্ট বৃদ্ধি কৰিবলৈ সক্ষম হৈছিলোঁ। পৰৱৰ্তী সময়ত কেইবাজনো ব্যক্তি বা সংগঠনৰ সহযোগত ৰাজ্যৰ সৰু সৰু চহৰসমূহতো আমি ICU নিৰ্মাণ কৰিবলৈ সক্ষম হৈছিলোঁ। ৰঙিয়াৰ দৰে নগৰতো আমি 50খনতকৈ অধিক বিছনাৰ ICU আমি নিৰ্মাণ কৰিবলৈ সক্ষম হৈছিলোঁ। কোভিড পৰিৱেশৰ সময়ছোৱাত ভাৰত চৰকাৰৰ ডোনাৰ মন্ত্ৰালয় আৰু ৰাজ্য চৰকাৰৰ সহযোগত আমি এটা প্ৰজেক্ট আৰম্ভ কৰিছিলোঁ, আছাম ক্ৰিটিকেল কেয়াৰ ইনফ্ৰাষ্ট্ৰাকচাৰ প্ৰজেক্ট, যাৰ জৰিয়তে সেই সময়ত আমি নেচিটছ, NEC আৰু অসম চৰকাৰৰ আৰ্থিক সাহায্যত অসমৰ প্ৰতিখন চিকিৎসালয়তে ICU নিৰ্মাণ কৰাত সক্ষম হৈছিলোঁ। কিন্তু ICU নিৰ্মাণ হোৱাৰ পিছতে আমাৰ সন্মুখত এটা প্ৰশ্ন আহি পৰিছিল যে হাউ উইল ৰান দ্য ICU, কাৰণ পৰম্পৰাগতভাৱে আমি যেতিয়া ICU এটা নিৰ্মাণ কৰোঁ আৰু তাক পৰিচালনা কৰিব খোজোঁ, আমি এনাস্থেচিছ, ক্ৰিটিকেল কেয়াৰ নাৰ্ছ, এই সমগ্ৰ ব্যৱস্থাটোত এটা যথেষ্ট মানৱ সম্পদৰ প্ৰয়োজনীয়তা আমি অনুভৱ কৰি আহিছিলোঁ। আৰু তাৰ লগত ICUৰ যিটো ষ্টেণ্ডাৰ্ডাইজেশ্যন, ICU প্ৰট'কলছ আৰু ICUৰ লগত জড়িত ডিজিটেল ৰেকৰ্ডছ, এই গোটেইবিলাকৰ ক্ষেত্ৰত there was a huge gap. আৰু as a result, most of the ICU, in spite of having equipments, remain unutilized. And even those who are being utilized, the result is not the way we wanted it to be. High mortality and high infection. Mortality because of infection, not because of the disease, is one of the remain a primary concern for all of us. Today is a landmark day because some of the unanswered question ji amar healthcare sector asil through digital and technology platform we are trying to provide answer to some of the unanswered questions. eGov, a NGO led by Shri Nandan Nilekani and Shri Nadamuni, is offering us some solution in collaboration with Corona Trust and HDFC and with a host of donor and resource person, that how we can run ICU in a hub and spoke model, how we can standardize, how we can put a strict protocol in place, and how medical records can be kept in completely transparent manner, and while doing so, the confidentiality of the medical records of the patient will be kept. So, এই যিটো project যে প্ৰতিখন জিলাত will activate 10 ICU and all hospitals, district hospital will be divided into spoke and they will be controlled from the hub in our medical colleges is a very, very important landmark. আৰু মই এই প্ৰকল্পটোৰ বাবে eGov and Corona Trustক মই e-Governance Foundation and Corona Trustক হলাগ লৈছো. I'd like to give my deepest gratitude to e-Governance Foundation and Corona Trust and of course the donor like Shri Vinod Khosla, HDFC Banks, Google Crowd and so on and so forth, because the list is long and in India the people who wants to do something good for the society is also, that list is also growing longer nowadays. So this is a very, very welcome development. আৰু মই সকলোকে ধন্যবাদ জনাইছো. আজি what we are getting in the project, e-Governance Foundation and Corona Trust is providing state-of-art medical equipment. As we know that medical equipment provided by Hamilton is very good so far as critical care is concerned. So those kind of equipments will be there, not in GMCH, but in all our district hospital. That is very, very important landmark. Then second component of the project, nurses will be trained, doctors will be trained, even if they are not anesthetists, but they will be trained to handle critical care patient. Thereafter, they will be connected to a hub in medical colleges so that 24 hours we can keep on providing support. Dr. Priyam has demonstrated us the technology that even if the doctor is in home, from there also he can provide support to the patients. Finally, standardization in terms of equipment management and in terms of treatment protocol, and finally a very good dashboard. I feel that this dashboard will be connected to our CM dashboard also, and we can keep on monitoring the situation on daily basis. মই ভাবো যে our health department will join this initiative with equal enthusiasm, and there will be continuous strengthening of both hub and spoke in terms of deployment of medical resources, human resources, good maintenance, and maintenance of good standard. In a country like India, where geography is so large, medical care by doctors in every villages or every helmets will not be easily possible. Although we will not surrender, we will keep on adding medical colleges, we will keep on adding teaching facilities so that we can ultimately achieve our goal of providing medical personnel at the doorstep. But still during the interim, technology is only the answer. Through technology and with the innovation of or application of 5G in India, I think medical care through technology has become very, very affordable and also easy. Just now when we have seen that the vitals of a patient who are in Mongoldoy, who is at present in Mongoldoy Civil Hospital, can be monitored in Guwahati Medical College, and from this auditorium we can see the vitals as if we have seen the vitals in our front. So that kind of technology with 5G has come to in our country, and I am sure that the medical fraternity will take full advantage of the technology which are in our possession today. We are also discussing about AI, ChatGPT kind of thing. Of course, I don't know how much answer will be there instantly, but this needs to be improved further, because sometimes when I also put question on GPT, sometimes answer doesn't come the way I wanted, and there's a lot of still gap between the AI and actual platforms. Of course, I am not a doctor, but on our field, when I try to seek some answer, then sometimes answer doesn't come the way I wanted or what is fact. I think that is a on evaluation, but I'll advise medical fraternity not to use GPT kind of things immediately until and unless it is completely verified, because to treat a patient with the help of GPT, you need some kind of legal sanction, because it may land up to problems. So, but this is evolution step, and I think within 1 year we'll reach that stage. There is no doubt, because technology is running faster than what we can even think of. Mur monot ase Yudhishthirok jetia Dharmarajai সুধিছিলে question, tat সুধিছিল je আটাইতকৈ speedত কোন যাব পাৰে, তেতিয়া answer was that mon আটাইতকৈ বেগী. But I think now technology has বহুত তাতকৈ বেছি speedত গুচি গৈছে. So that's the change we have seen over a time period. So thank you very much, Srikanji, and hope this partnership will continue. And on health sector, we are immensely committed. We are spending more than 6% of our GDP in health sector, and every year it is increasing. There is no doubt on that. And we are also on public-private partnership. We are doing really very good in terms of cancer care and many other initiatives. So I have some idea also that how we can address some more critical gaps in healthcare through digitization and technology. Definitely will carry forward that discussion. আজি এই অনুষ্ঠানৰ লগতে গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ বাবেও নেশ্যনেল ইমাৰ্জেঞ্চি লাইফ ছাপোৰ্ট স্কিল চেণ্টাৰ, মাল্টিডিচিপ্লিনাৰী ৰিচাৰ্চ ইউনিট, ইণ্ডিয়ান অইল কৰ্পোৰেশ্যনৰ সহযোগত 32 স্লাইচ চিটি স্কেন তেখেতসকলে আমাক বৰঙণি হিচাপে আগবঢ়াইছে। মোৰ ইণ্ডিয়ান অইল কৰ্পোৰেশ্যনলৈ বহুত বহুত ধন্যবাদ। আৰু আমাৰ মলিকুলাৰ অংকলজিৰ ওপৰতো আজি আমি ইয়াতে খুব ষ্টেট অফ আৰ্ট লেবৰেটৰী এটা উদ্বোধন কৰিছোঁ। মই ভাবোঁ যে প্ৰিভেনশ্যন এণ্ড কণ্ট্ৰল অফ কেঞ্চাৰৰ ওপৰত আমাৰ যিমানখিনি প্ৰচেষ্টা, তাত আজিৰ এই মলিকুলাৰ লেবে যথেষ্ট আমাক সহায় কৰিব। আমাৰ ৰাজ্যৰ মেডিকেল ছেক্টৰত সঘনাই সন্মুখীন হোৱা আমাৰ এটা ডাঙৰ প্ৰব্লেম হৈছে যে ইকুইপমেণ্টছ মেইনটেনেন্স। আমাৰ obviously in our medical college, we cannot provide 2 MRI or 2 CT scan, 3 CT scan. So asset maintenance is a very, very big challenge for us. মই ভাবো যে আটাইতকৈ আমাৰ আজিৰ দিনত সমস্যা যে এখন মেডিকেল কলেজত যেতিয়া মেচিন বেয়া হৈ যায় আৰু তাক অন টাইম যেতিয়া আমি ৰিপেয়াৰ কৰিব নোৱাৰো পেশেন্টৰ বহুত বেছি অসুবিধা হয়. We are constantly trying to address the issues that how in Assam we can put a very good maintenance team je amar jate machine beya nohoy till the lifespan. That is why we introduce CMC, that all our equipment will be backed by comprehensive management. But there are many equipment where in spite of the agreement, the engineers come at a very late, and a lot of patient has to face the kind of agony. So today we are starting a asset management portal. At least now we will know that how many equipments are not in order, when we have asked the company to repair, how much time they are taking, and all this can be considered when we are trying to award a fresh order to the company, because maintenance is the key. The company who is not good in maintaining the equipment, I think they do not deserve fresh order. So this asset management portal will be a great help towards our maintenance of assets properly. মই পুনৰ এবাৰ স্বাস্থ্য বিভাগক আজিৰ এই সুন্দৰ অনুষ্ঠানৰ বাবে ধন্যবাদ জনাইছো আৰু মই আশা কৰোঁ যে আমাৰ স্বাস্থ্য বিভাগৰ যেটো উত্তৰণ সেই উত্তৰণ অব্যাহত থাকিব বিশেষকৈ ক্ৰিটিক্যাল কেয়াৰত আমি কন্ট্ৰিবিউট কৰিব পৰাটো আমাৰ কাৰণে এটা বহুত ডাঙৰ সৌভাগ্য মই নাজানো why but in spite of our best effort in last 2 years road accident case ami komabo pora nai. Every day is number is increasing. We have we tried to rectify road. We introduce many best practices. We force people to have helmets. Everything whatever in our command we have done, but still we are not able to so far we have not able to reduce road traffic accident cases to the desired level, and we can save life only when critical care is in place. Otherwise we cannot save lives. So moi bhabu this is very important for us aru aji ami jitu kam korisu tar folafol definitely ami pam, and I feel happy that our hospital like Hailakandi, Karimganj, they have become very, very proactive. Our health sector at a gaps asile, the certain district we could not offer the health care to the desired level, primarily because of geographical remoteness and also due to motivational factor. So if in our state, Haflong, Karimganj, Hailakandi hospital gets award for motivation, then this is a very, very important landmark. So moi আটাইকেইখন চিকিৎসালয়কো ধন্যবাদ জনাই পুনৰ এবাৰ আপোনালোক সকলোকে ধন্যবাদ জনাই মই মোৰ বক্তব্যৰ সামৰণি মাৰিছো ধন্যবাদ
Thank you sir. Thank you sir for your valuable speech, and your parallelism of technology with Ulysses' saying is very relevant and inspiring. As we have arrived at the end of this remarkable ceremony, I would request our principal sir to deliver the vote of address.
আজিৰ সভাৰ আমাৰ 10-bed ICU project লগতে আমাৰ গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ 5টাকৈ project উন্মোচনৰ মুখ্য অতিথি অসমৰ মাননীয় মুখ্যমন্ত্ৰী ডাঙৰীয়া স্বাস্থ্যমন্ত্ৰী মহোদয় স্বাস্থ্য বিভাগৰ প্ৰধান সচিব Medical Education and Research Commissioner Secretary Sir, MD Madam, DME, Commissioner Secretary, PWD, Special Commissioner, E-Governance Co-Founder, Srikant Nadimuni, Guwahati Refinery CGM, PK Bosumotari, Logote HDFC Bankor, Dr. Mr. Kaur, Aru Logote Honglogno Hua, Homosto, Donor, Aru Bahiror Pura, Zikini Amar Logote Honglogno, Hokolo Sikitsaloy, Moi Guwahati Chikitsa Mahabidyalয়ৰ তৰফৰ পৰা বিশেষকৈ পোনপ্ৰথমে মই হলাগৰ হৰাই আগবঢ়াব বিচাৰিছোঁ ব্যস্ততাৰ মাজতো আমাৰ অসমৰ মাননীয় মুখ্যমন্ত্ৰীয়ে গুৱাহাটী চিকিৎসা মেট্ৰৰ আহি আমাক অনুপ্ৰেৰণা জনাই আমাৰ গুৱাহাটী চিকিৎসা মহাবিদ্যালয় তথা চিকিৎসা খণ্ডৰ বাবে যিখিনি তেওঁ উপদেশ আগবঢ়াই গ'ল তাক আমি নিশ্চয় মনত ৰাখি আগবাঢ়ি যাম লগতে হলাগৰ হৰাই আগবঢ়াইছোঁ আমাৰ মাননীয় স্বাস্থ্যমন্ত্ৰী মহোদয়লৈ তেখেতে তেওঁৰ ব্যস্ততাৰ মাজতো সঘনাই আমাৰ ওচৰত আহি এই প্ৰজেক্ট কেইটা কেনেকৈ কৰিম তাক আমাৰ সময়ে সময়ে তেওঁৰ উপদেশ দি গৈছে লগতে মই স্বাস্থ্য বিভাগৰ প্ৰধান সচিব স্বাস্থ্য বিভাগৰ আয়ুক্ত সচিব সকলোলৈকে মই তেওঁলোকৰ উপদেশৰ কাৰণে আজি ইয়াত হলাগৰ হৰাই আগবঢ়াইছোঁ লগতে আমাৰ এই সমস্ত 10-bedded ICUৰ co-founder শ্ৰীকান্ত লগতে HDFC বেংক আৰু বিদেশৰ পৰা সংলগ্ন হোৱা বিনোদ খোছলা আদি কৰি সকলোলৈকে মই হলাগৰ হৰাই আগবঢ়াইছোঁ আৰু লগতে আজিৰ এই গোটেই কামখিনি 10-bedded ICUৰ কোঅৰ্ডিনেট কৰাৰ কাৰণে কৰোনা ট্ৰাষ্ট আৰু ই-গভাৰ্নেন্স ফাউণ্ডেশ্যনৰ ফালৰ পৰা বিষয়াকে লগ কৰি আদি কৰি সকলো বিষয়ববীয়াক মই হলাগৰ হৰাই আগবঢ়াইছোঁ আৰু শেষত মই আজি এই সভাখিনি সাফল্যমণ্ডিত কৰাৰ বাবে আমাৰ অভ্যাগত অতিথিসকল সমগ্ৰ অভ্যাগত অতিথিক মই হলাগৰ হৰাই আগবঢ়াইছোঁ আৰু আমাৰ কলেজৰ অধ্যাপক অধ্যাপিকা ছাত্ৰ ছাত্ৰী কৰ্মচাৰীবৃন্দই এই সভাখন সুন্দৰভাৱে চলাই নিয়াত যি সহযোগ আগবঢ়ালে তেওঁলোকলৈ হলাগৰ হৰাই আগবঢ়াইছোঁ আৰু শেষত মোৰ প্ৰিণ্ট মিডিয়া আৰু ইলেক্ট্ৰনিক মিডিয়াৰ বন্ধুসকলক মোৰ হলাগৰ হৰাই আগবঢ়াইছোঁ আৰু মই এইখিনিতে আমি যিখিনি উপদেশ আজি আমাৰ মাননীয় মুখ্যমন্ত্ৰী মহোদয়ে দি গ'ল তাক আমি নিশ্চয়কৈ গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ তৰফৰ পৰা আমি সদায় পালন কৰি যাম আৰু ইয়াকে মই বক্তব্যৰ সামৰণি মাৰিছোঁ
I request everyone to kindly stand up for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे